I am Dr. Vandana Goel. We from Healtheoz shall be discussing birth defects today. The birth defect is any structural or functional abnormality present in a baby since birth. So when we talk on structural, it means deficiency of any body part like cleft lip or cleft palate. Or when we talk of functional, means there is any mental retardation present since birth, like in Down syndrome. See, if 100 women are delivering a baby, then out of them, 3 to 4 have a risk of born with birth defects. But this number is increasing since we have artificial reproductive techniques and leading to delivery of multiple pregnancies like twins. They have almost double incidence of having birth defects. As far as the common birth defects, though usually the ones with the brain or the cardiac birth defects, that is the heart abnormalities, they are the most common. But the the most common varies according to the place of your birth, that is your ethnicity. Among the genetic causes, the most common is the Down syndrome. See, unfortunately, in 70% of the times, we do not know any cause. But 20% of them are mostly due to genetic causes, which could be inherited in the family, or they could occur because of some chromosomal defects. And 10% of the times it is some environmental factor like excessive exposure to some toxin or radiation exposure. See, birth defects are not 100% preventable, but yes, certain points are there which you can follow to reduce your incidence of birth defect. One of them is the most common folic acid you must have heard of. It's a vitamin which is taken preconceptionally 3 months before you plan and 3 months after the pregnancy. And then the second is, if you're already on some medical treatment, then you should review your drugs with your specialist before you're planning your pregnancy. And in general, you should maintain a healthy lifestyle, which means free from addictions and colorful food items. And if you're into excessive exercise or a totally sedentary person, then you should maintain your weight to the optimum. Usually, most of the birth defect happen during the time of organogenesis, that is almost 3 months preconceptional, the tissues start forming, or the up to 3 months post-conceptional. But still, certain brain and heart are two evolving organs. So these some of the defects can still present even just at the time of birth and go undetected till birth. See, nowadays we have a whole battery of prenatal tests, usually some blood tests which are usually for the Down screening, and you've heard of dual marker, triple marker, quadruple marker, the NIPT and certain tests, and of course the scans, the ultrasounds, out of which we usually say 2 being minimum for anomaly, for knowing any baby with birth defect, which is the 11 to 13 plus 6 weeks NT-NB scan, and around 18 to 20 weeks the anomaly scan. For these details, you can visit our video on prenatal tests. Usually, most of these birth defects are not correctable, but certain can be operated post-delivery after the baby is born. There are very few where we can help you in some way, giving some medicine to the mother or maybe some operation on the surgery on the baby while in the womb. But for that details, you should consult a fetal medicine specialist. No, absolutely not. See, there is a whole category of types of birth defects. Some of them are incompatible with life, which we call the fatal defects. Most of the time, by 12 weeks or so, where the window period is given in different countries till when you can terminate. So many times the pregnancy gets terminated for itself when a baby is there with fatal birth defects. Then certain birth defects, even if they are present, will not harm the baby in any way. Something as basic as missing of one finger. I mean, a baby will not have any problems in life because of that. So you might as well continue, the baby will be healthy. Certain defects are correctable post-delivery, as I told you. So definitely not indicated medical termination.